Hi, I'm Ed O'Neill, professor of medicine, nursing, dentistry, pharmacy, and director of the Center for the Health Professions at the University of California, San Francisco. Today we're going to be talking a little bit about the change process, but from a slightly different perspective. We're going to be looking at change from the bedside, from the point where actual care is delivered, and asking some questions about what individuals within that organization, like a hospital, can actually do at that level to produce change. Healthcare and the delivery of healthcare demands a great deal of change today for three simple reasons. One, it's too costly, and we're going to have to be able to make it more efficient. Second, the quality of care that we actually deliver can be improved and needs to be improved, both in terms of quality but also for patient safety. And finally, the experience of the patient as a consumer has room for improvement. So those three things, the cost of care, the need to enhance quality, and the need to enhance the consumer experience for the patient, mean that we need to change the experience at the hospital. We oftentimes think that change is something that the suits in the C-suite up at the top of the building are responsible for. But the reality is that the experience of change by the customer, the patient, the real cost efficiencies, and the improvements in qualities come right at the bedside at the point that we deliver care. It's not to say that the folks in leadership roles can't help make that happen, but real change occurs when nurses and other clinical staff and non-clinical staff do their work differently. And nurses are the most important professional in that context to actually make that change. The most important thing that a staff nurse or a nurse in a management role within a hospital can do is to actually understand the need for change first, to actually own those drivers for change, not to deny the need for change, and then to look for instances where problems are extant at the bedside, in their units, on their wards, where that real change can actually focus. So I've got the big picture, but now I've understood how that big picture is manifesting itself in a problem actually on my unit. 60 days is a very short time to actually change something, but it can be done. It's important to limit the problem, and the way you limit the problem is not to get a small problem that's not connected to anything else, but you get a small problem that's a piece of a larger problem, but you focus on that dimension of the problem that can actually be changed in 60 days. So let's just think about something that's very simple, like changing information or exchanging information between two professionals. There's a pattern that's not working. Physicians and nurses aren't communicating something about the status of the patient. We've gotten into a habit of communicating in this way. It's worked okay for the past 10 years, 20 years, 30 years, but it's really not the most effective way to guarantee the patient's safety. That exchange of information, that small change, could actually be addressed in a time period much shorter than 60 days. What you have to do is to identify the problem, get all of the relevant people to buy into that understanding of the problem, use that same group to come up with some alternative solutions, and then try it out. And now the final piece is you do need to measure the effectiveness of that change, because some changes that we think are going to be good really don't turn out to be so good. So it's important to have those four elements in place, and if the problem is focused, you really can change things that are important in 60 days. The first step in making change, after you have some sense about that I really do need to change because of these big drivers out in the rest of the healthcare system, is to focus on a problem that's important to you, that's real to the patients, that's important and real to your coworkers. And once you get that problem identified and narrowly focused on, then you can take the other steps to begin to change. But without that focus, you'll dissipate all your efforts in actually worrying about things that are beyond the scope of what you can actually impact. One of the best ways to identify a focused question or problem or small cycle change issue, if you can't come up with one, is to actually ask colleagues. So what is it that's troubling you? What do you think we could easily reach out? Sometimes we talk about that as the low-hanging fruit. What's available to us? What's annoying to us that we think we could change? Oftentimes, the good candidates are things that you have a lot of discretion over. You control that, and think hard about that, because sometimes we think we have no control over things, but we actually do. Secondly, something that's disruptive or uncomfortable or not performing. And we may just know that in our gut, but it's important to bring some of that judgment to it. And then finally, something that at least a few other people also believe is an important problem. That whole process, though, could be a lunchtime conversation with three coworkers. It's not something that requires a lot of permission or requires a lot of attention from other people. You could actually raise those issues in a moment and get all of the input that you need. Making a small change or even a big change last is a really important consideration. A few things that need to be mindful of as we go into it. First is, do the people that are involved with the change really understand it and own it? So that means you can't go through any shortcuts. Whatever process you've gone through to come to understand this is a real problem, to think it's important, to invest time, they've got to go through the same changes, because if they don't, they won't believe in it and they won't stick through it, because even change on a simple level is really difficult for people, because they're used to doing it in a certain kind of way, and they've built parts of their life around it. So their engagement's important. So asking questions, posing situations, asking them to respond, even if you have the answer, it's important to let them struggle with that for a while. Second thing is once people get engaged in the problem, is to get everybody engaged in the solution. So what are the possible remedies that we could have? And the more involved that discussion is, and the more that individuals contribute to putting together the solution, the more likely that's going to be long-lasting. The third element in terms of the permanence of the change is that whatever the environment is that the change exists in needs to support the change. So if you want someone to change the way they do work, and you can reward them for doing work the old way, but you don't change that reward, even after they change, they continue to get rewarded for doing the work the old way, then that change obviously will not last. But that's a pretty dramatic example. But even in terms of very minor kinds of adjustments to positively reinforce that change, if you don't think that through and reinforce that, then the change won't last. So if you've made a change where you've told people this will make our work easier, and it doesn't make the work easier, it's actually more complicated, then people won't stick with that change. They'll stick with it for a while, but it actually has to deliver on the promise of better care, easier work, safer work, better pay, a better tie to my values. It somehow has to be positively reinforced. So those three things: engage in the problem, engage in the solution, and change the reward structure of the organization. Stakeholders in change are really important. It's a very fancy word. Stakeholders are just the other people that are impacted by the change that you want to push forward. If you want to actually have the change last and not just be your good idea that they casually entertain for a while, then you have to understand them in the context of the change. So first of all, just identifying who they are, who is going to be impacted by this change, what's their stake in keeping the status quo. And everybody has some stake in keeping the status quo, even just the little stake of, well, I just don't want to do anything differently. What's in it for them if we do change? Are their values better met? Is their work more fulfilling? Do they get more control over their work? Is their opportunity to interact with patients better? Can they get to what they really like and love most at the job? And it's going to vary for everyone. In fact, one big mistake that change agents make is they think that everybody values things the way that they do. So it's very important to raise the question and then listen carefully. What is it that's going to motivate this person to change? How do they understand the nature of the challenge? What do they bring to the solution? And the most important thing is to step away from that process, help the process go forward, but then listen and be sure that you engage them, the stakeholders, in that process. Assessment of the environment is an important concern for any kind of change effort. And you need to think about the environment in several different ways and really just a level of complexity. There's the immediate environment. What's the dynamic of the workplace? What are the challenges that we face? How are our resources changing? Budgets, personnel, space, equipment, all those kinds of things are really important. The second environmental information that a change agent, particularly one working at the local level, at the bedside level, what are the strategic business directions for the organization and the vision that the organization's pursuing? Now, some organizations don't have a good vision; they don't articulate good strategic business goals and directions. But assuming that they do, what are they, and how does your project, your change, your problem fit into that? Because it may be a problem, it may be a good idea, it may be something that needs to be changed, but if it's really going to have success, it needs to fit in to this coherent structure that the organization has articulated. Now, again, hopefully they have articulated that. But how does that help meet the goal of enhancing the quality of patient care? How does it meet a goal for patient safety? How does it bring efficiencies to the unit? How does it help enhance that customer or patient satisfaction? So if you can think through your change within the articulated strategic business goals, that's the second level of the in landscape, the environment that you need to be aware of. The third level is what are the big, broad macro changes that the whole healthcare system and broader society is going through? Now, these you should actually see in the strategic business objectives. We're concerned about cost because healthcare costs too much. We're concerned about quality because there are a lot of quality errors that exist within healthcare. We're concerned about patient satisfaction because we're entering a competitive market where consumers or patients can take their business and go elsewhere. So you want to be able to understand your problem that you want to deal with at the unit level from the context of the strategic goals of the organization, and then see them in the broader context of healthcare and then the broader society that we're in. Frequent question that folks are concerned about is what kind of authority, power do I actually have? It's important to think about power not in a unitary kind of way, but in all of its various manifestations. So some of the power that every nurse brings is the ability to understand a care process right at the level at which it gets delivered. And we're going to change things. We're going to actually be changing that process. Now, the tools to change that process are things like policy and reimbursement and technology and those other things, but it's the actual care process that the nurse at the bedside really understands that's going to be changed. And that understanding brings enormous power. So just that understanding of the core process is a source of power, and it's one that nurses shouldn't give up. The second source of power is a willingness to change. And that sounds a little bit like a sort of self-fulfilling prophecy. Well, I need power to change, and I'm willing to change. But if you think about that, there are a lot of folks that are resisting change, and if you are willing to say, no, some of the things that we do need to be changed, and I'm willing to work on that, that's a great source of power. Third, just taking the time and gathering the insight and perspective to think about a problem. That everything we do here isn't perfect. It's not the way God intended it to be, and I'm willing to think about it in a creative way and come up with some solutions. Much better for those solutions to come from the bedside, and most managers, not all managers, but most managers actually welcome that. Someone thinking in a critical way about what's going on and how it can be improved. The biggest frustration I hear from managers and directors of nursing and even folks in the executive team within a hospital is that nurses don't bring critical thinking and critical judgment to their work. And if you think about that, not very hard, it's easy to understand that what they're really asking for is how do nurses, highly trained, highly compensated professionals, bring change to the process at the bedside. That's the critical thinking skill that they're really talking about. Now, they don't always welcome the change, in part because sometimes it's not positioned as well as it might be by the nurse as a change agent. And sometimes it's just not welcomed because it's not the best leadership at the top. But that's fine. It's still a source of power for the nurse to be able to frame that change and then have the courage to push that change forward. Those are important sources of power. So to actually capture that power, to own that power that nurses may potentially have, it's important to think about two or three things. The first one is just to be self-critical. So what am I good at? What am I not good at? Am I willing to actually understand this change? So just getting some insight into yourself. It's an important leadership trait, and in this case, it's an important change trait. Second one is to understand how you're invested in the status quo. So what do I bring to this that's keeping us from actually changing? It's very easy to see what other people are doing to keep us stuck in the mud, but very difficult to see it for yourself. And if you can develop that insight, it's going to make you better able to work with other people because you'll be a little more understanding. Plus, they won't see you as so self-serving. The third thing is then just to have the courage to push ahead. You're going to have to ask your other people, these stakeholders, to get involved. You're going to have to, at some point, if you're doing change at a significant level, you're going to step on some toes. So you've got to be willing and able to do that in a politically sophisticated way so that people understand you're not just pushing your agenda, you're pushing this agenda to change, to improve the unit, the ward, the individual care that's delivered at a single bedside. And it's very hard for people to resist that, but it does take courage to stay the course with that and not just get defeated the first time someone pats you on the head and says, "Nice nurse, but we don't really want you to do that." And that will happen. Overstepping the role is really a great question for change, and it relates to some of what we've already been talking about. But this issue of the nurse as critical thinking professional is an important one. And I think it boils down to not should I be a critically thinking, engaged professional, but how am I going to do that? So am I going to be pushing the change that I want as a zealot, as a true believer that doesn't want to listen to anyone else and who hasn't gone through this stage of at least being a little bit self-critical? What do I bring to the problem and how do I contribute to the status quo staying the same? To one in which we really get the problem out there as an objective reality, we collectively work on it, and then we push for the policies to not only change it, but that really important dimension of changing the reward structure so that it can be sustained over the longer haul. So putting the change in a sophisticated political context is the best way for nurses to be enabled or entitled to push that change. Sometimes they wait for other people to give them the keys to the kingdom to do that, and that's a long wait. And so much so that you'll wait while people get around to giving that to you. They're always fixing to give you that power. But to push ahead, have the courage to push ahead, but in a way that's sophisticated and involving of other people, not just confrontational with other people, I think is the best way for a nurse to get engaged in change at that unit level. If no one listens, that's a great question to the change. Just a quick story. Years ago when we were starting one of our leadership programs, one of the participants had recently been appointed to be the chair of a department of surgery at a big medical center here in California. He happened to have been the youngest faculty member in the department and the only non-tenured faculty member. He was very smart, very creative, and very committed to change. So he came up with 2 or 3 things that he thought could really change the department to make it better. A different way to appoint patients, different way to schedule students, and a different way to bill and get collections. And these were seemingly great changes that everybody would welcome and just accept and no problem or issue. All of his senior faculty, in effect, patted him on the head and said, "That's very nice, we're not going to do it." So what he did was he had enough authority, at least he was, as my 13-year-old would say, "I'm the boss of myself." At least he was the boss of himself. He was, after all, the department chair and a board-certified surgeon. So he actually made the changes that he wanted to impact for the whole department, but just for himself. And then what he did, very intelligently, I thought, was he collected data on how many more patients he was able to see with the new scheduling process, how much more efficiently he saw students with the new student scheduling process. And then as a kind of separate gouge in the eye, he also tracked at what hour he went home. And with these new efficiencies, he was getting home half an hour, 45 minutes, sometimes an hour earlier than before. And then the coup de grace was he actually tracked how his collections increased and his actual pay increased. And he kept those data and he posted them on the door of his office. He didn't have an editorial comment. He just posted the data that his changes actually improved the situation. And then he just waited for the senior faculty to come groveling to him and asking if they could also do this. And he, I think, with some theater involved, reluctantly agreed to let them have these wonderful things. So you always can demonstrate it yourself. I mean, you're not always the chair, so if you're breaking the rules, you shouldn't do that. You should go and ask someone, could I demonstrate how we would do this if I break the rules? But you can always do it yourself and to demonstrate that and let other folks come in. The one choice that some people make is to go over the heads of people and get others to dictate the change. But if you think about that, if somebody goes over your head and dictates you to change, you're really not committed to the change, nor will they, even if it's the right thing for them to do. So better to demonstrate or to get one single colleague to work with you to demonstrate a better way to do that. And then make sure you collect the data, because you are going to be able to want to be able to show them with chapter and verse exactly how it has improved in whatever area you want it to be improved on. People don't change sometimes because they fear failure, and hopefully you work in an environment that actually encourages failure. Not all the time. We don't want people to fail every time they try something. That's kind of absurd. But what we do want to do is to have an environment that says you're going to fail. If you're taking on really complicated questions that involve a lot of people, you're not always going to be successful. So try it. If it does fail, do an analysis of it. Why did it fail? Did you inadequately get stakeholders involved? Was the solution not rich enough? Did you not have the resources tied down, or was an executive sponsor not in place? So go back and do a post-mortem on any failure. Very few people actually fail completely, and if you do, that's still fine. But it's even a partial success. Well, we got some of what we wanted, but why didn't we get the rest? Go back and take half an hour with your colleagues to pull it up, take a look at it, discuss it, because that actually produces learning that's incredibly valuable.